Welcome everyone to the first Discovery to Commercialization event of the year. So this is we got a great lineup of speakers today talking about funding and resources, and we have a really good turnout. So next slide, Amanda. So I'm David Granville. So I'm your host of this seminar series. I'm located at Vancouver Coastal Health and the UBC. Next slide. So at this point, I'd like to recognize that we're conducting our business today on the traditional homelands of the Musqueam, Squamish, and Tsleil-Waututh peoples. And again, this is the Discovery to Commercialization series. The main purpose of this series is to bring together people across the Vancouver community and the life sciences community, from industry, the academic basic scientists to clinical researchers, as well as funding groups, and to get people working and talking together. Next slide. So this is our group today. I'm going to, so the way it will work today is we'll have all four speakers present, and then we'll have the questions at the end. And I'm going to introduce our chair in a minute, but just to go over a few housekeeping notes. So this event will be recorded. The moderator will lead the questions. So please put your questions in the chat box, and then these will be read out by Sean at the end of the talks. So please do that. And again, please keep your microphone on mute unless you need to speak. Thanks. And so at this point, I will introduce our moderator, Sean Lumb. So he's the Associate Director at the Entrepreneurship at UBC, or better known E at UBC. So Sean has worked as a Senior Technology Transfer Manager with the University Industry Liaison Office at UBC, also as a Senior Business Development Manager at Melbourne Ventures at the University of Melbourne in Australia, and served on Uniseed's Investment Committee. And as I mentioned, he's currently the Associate Director at the E at UBC. So at this point, it's my pleasure to pass the virtual mic over to Sean to lead the rest of the session.
All right. Thanks very much, David. Thanks very much to the VCHRI team for the invitation to participate and to moderate the panel today. It's a subject that's near and dear to my heart, and so I'm super excited to participate and also to interact with this fantastic panel of speakers that we're going to get to in just a few minutes. I thought I'd just kick off the session with a brief introduction to entrepreneurship at UBC for those who might not be familiar with the organization. And so I will just share some slides with you briefly. Can everyone see that? Thumbs up, excellent, okay. So again, thanks very much for the opportunity to participate. Entrepreneurship at UBC is the University of British Columbia's venture builder. We have a dual mandate. Of course, we're at an academic institution, and so prime mandate of what we do is to enrich the educational experience of students and researchers by providing opportunities to become entrepreneurial thinkers. And we do that within the context of building or helping to build transformational ventures that positively shape our economy and society. And we do this by inspiring entrepreneurship, educating about the entrepreneurial pursuit, and actually helping to build transformative ventures with clients from the university and affiliated institutions. To give you just an idea, we've been around since 2013, and the venture impact that we have measured, economic impact primarily, is shown on this slide. We've worked with over 500, almost 600 venture teams. Of course, not all of those have been wildly successful, but a fraction of them have been successful, and they've been responsible for the creation of over 1,000 jobs in that time, generating over $110 million and having raised over $1 billion in various forms of venture capital. So how we do this is best illustrated on this slide, which is our venture building pipeline. I'm not going to go into details about the programming and resources, except to say that through our community engagement, and we do an enormous amount of community engagement, and we host events and networking opportunities. We recruit promising opportunities into our pipeline, and then we apply workshops and programming and other resources to help those opportunities to validate the venture opportunity and build a real venture. And those resources include, as I've already mentioned, venture building workshops, deep mentorship. So we've got a very active mentor network of over 200 participants who we pair with the ventures that we work with in our workshops. We have a venture intern program, so we recruit both technical and MBA interns as a part of summer internship programs to work with the ventures that we're supporting. We have entrepreneurs in residence with expansive global networks who work one-on-one with the venture teams that we support. Through faculty and departmental partnerships that we have, we can offer the ventures we're working with makerspace and wet lab space. And again, through the networks that we have, we offer access to capital. And I just want to recognize ISICS and SBME as partners who have formalized a relationship for makerspace and wet lab space. And in addition to our fundamental venture building programming, we also have what we call venture studios, which are virtual studios that provide augmented resources that are industry specific. So we have a social venture studio for social impact ventures, climate venture studio, which provides industry specific resources for climate ventures, and of course relevant to this talk today in this organization. We've got a human health venture studio, and we have lead entrepreneurs in residence who are responsible for building the community within those studios. And Mr. John Jafari, who many of you may be familiar with, is our lead entrepreneur in residence for our human health venture studio. And I think John is here today for the session. So to understand when is the best time to engage with UBC, it's useful to think about the evolutionary timeline for a venture. And so often, and particularly people in the audience today, will start to think about the commercial potential beside a research invention that I'm showing on the left-hand side of the screen. On the far right-hand side of the screen, you have ecosystem anchor companies, such as, for example, Stem Cell or Obcelera or Zymeworks, which are significant ventures that have grown and scaled and employ a large fraction of the workforce. They may be partnered with global or multinational partners in their industry ecosystem, and they may be acquisition targets for that ecosystem. But there's a lot of things that happen in between research invention, and a lot of time potentially that will pass under the bridge between research invention and ecosystem anchor. Looking at this, there's usually a translational proof of concept and market validation phase, often this is before there's any kind of a venture incorporated. And there's usually an appropriate time when the company is incorporated and founded and market traction is developed, followed by company growth, market expansion. And then with additional resources, financial and so on, these companies grow into the ecosystem anchors that we know today. If we think about the translational resource gap around company founding, and we represent that gap by the size of the chevron, there's a translational gap in the pre and post incorporation stages for a venture opportunity where there's just scarce resources available to researchers in this particular case to start up and build a venture. And this is the sweet spot where entrepreneurship at UBC can apply resources, the resources of our programming, the resources of our mentor network and other networks to help founders to transition this translational gap of scarce resources. And we've developed something we call the 4 T's venture playbook that breaks this translational gap down into 4 parameters: team, tech, traction, and treasury. And we can apply different resources, and we help the team to identify what the major milestones are to navigate and overcome these translational gaps. On this slide, I'm just showing a few examples of ventures that we've helped over the history of entrepreneurship at UBC, and you will obviously recognize some names that are on this list, but I wanted to focus in on one in particular, a recent venture that we're still working with, in fact, Abozymes Biomedical, that you might be familiar with. Abozymes is working to realize a world where blood type is no longer a constraint for those receiving life-saving organ transplants or transfusions. Just reviewing the brief history of our engagement with Abozymes. They joined entrepreneurship at UBC in March 2020 for a venture founder cohort led by Dr. Peter Rothfeld and his fellow scientists. In the fall of 2020, they expanded their executive team. So they were working with 3 different entrepreneurship at UBC mentors, and the relationship went so well that they offered the president and CEO role to Dr. Jeff Holton. John Barclay joined as their VP Business Development, and Doug Buchanan joined the board of directors. In January 2020, they joined our Hatch Venture Builder, and most recently in December, it says December 2022, we're not quite there yet, thank goodness. In December 2021, they added Dr. John Coleman as the successor CEO to Dr. Jeff Holton. Jeff will remain on the board. What's really interesting there is John Coleman is a co-founder of Anandia Labs, which is a former client of entrepreneurship at UBC. And Anandia was acquired in 2018, I believe, and now it's gone full circle. And John is coming back to work with another entrepreneurship at UBC supported venture. In terms of awards and recognition, Abozymes was featured in TechCouvr's 10 homegrown BC startups to watch in 2021. They were a top 10 venture in the 2020 New Ventures BC startup competition, and they've raised well over $1 million now. But in this particular seed round, they raised over $1 million in 2020. And I think this is a fantastic example of this translational gap around company founding and entrepreneurship at UBC, helping the founding team to navigate and overcome some of those barriers to these scarce resources that exist at this translational stage around company founding. Anyway, that's really the end of the talk that I wanted to give about entrepreneurship at UBC. Happy to talk in much more detail with anybody who's interested. Shameless plug, we are actually recruiting for our venture founder program right now. Applications are open, and so if you know of anyone, or if you yourself are thinking about pursuing a startup idea, have a look at our website. And I think the initial deadline is actually Friday for application, but we'll always consider latecomers to that. But what I'd really like to do now is pursue this theme of funding and resourcing to get your discovery started by introducing our first panel member, who is going to talk about MyTax and MyTax's role in supporting the commercialization of discoveries. So pleased to introduce Dr. Sherry Zhao of MyTax. As Senior Account Manager and Team Lead, Sherry works with major industry partners to support their innovation pipeline. First generation immigrant to Canada, Sherry believes deeply in the power of diversity and globalization. She serves on the Board of Governors at the Business Council of BC and the Advisory Committee for the SME Scale-Up Center at the Greater Vancouver Board of Trade. Sherry holds a PhD in chemistry from UBC and a BSc from Peking University. And prior to joining MyTax in 2014, Sherry worked at Genentech in San Francisco, supporting the technology development for biopharmaceutical characterizations. Sherry, it's a pleasure to have you with us today, and I'll turn it over to you.
Thank you, Sean, for the introduction. I'm going to quickly share my slides. While I'm doing so, I wanted to express how excited I'm here today. As you might have heard from Sean, that prior to MyTax, I was with Genentech, working on pharmaceutical research. So health research is always dear to my heart. So thank you so much for having me today. And if somebody can quickly give me a sum up about seeing the slides, great, thank you, Kara. And today I'm really proud to be talking to you about Mitacs and how we can support your innovation journey from transitioning into commercialization and also beyond while your venture is very well underway. So some of you have interacted with my team or myself in the past. For those who haven't, we are a national not-for-profit organization that fosters growth and innovation both in Canada and globally. We did start from a very academic route 22 years ago as a network of center of excellence. But over the years, we've grown into a fairly medium-sized organization across the country with more than 300 staff and supported more than 47,000 research projects. And all those projects are collaborations. So we do have a track record of many years in operation and lots of funding to spend, as you can see. And the reason why Mitacs exists is I feel I am preaching to the choir right now that I'm talking to a group of health researchers, and because we all know that innovation is the driving force that generates economic and social benefits for generations to come. And Canada, especially at the inflection point throughout the pandemic, we have seen the power of innovation and is continuing to see the power of innovation. So at Mitacs, we're really proud to be able to support that journey along the way. And the way we do it is to start with the needs of the market, the needs of the society, to promote human capital through the collaboration. And we'd love to advance the entrepreneurship and productivity through the collaboration with academia. And some of you have worked with companies, some of you are thinking about launching a company. But I am pretty sure all of you know that when you're thinking from a company perspective, when there is a need for innovation, the first thing the companies start to think about is whether they have the right expertise, the resources, the talent, the equipment, the facility. And also it comes down to whether there is enough budget. Once those are resolved, a roadmap of the innovation product map is always needed. So the three topics listed here are typically what we hear from the company clients, the hurdles or the considerations that they have when they are considering venturing into a new innovation agenda. And the way we do it, of course, is to help along the way by connecting those challenges with talent and expertise through the post-secondary institutions and turning those into solutions. So we provide this financial support, and I will get into the details about the funding support we offer currently. And with Mitacs, once you have launched your venture, be it really early stage, you can tap into our national research networks and also expanding beyond to connect with our partner country institutions to bring the expertise to your doorstep. And also because now we are expanding, we have been operating in all the disciplines beyond our roots, which is math and information technology. We are seeing more and more health research and also related topics. So we would love to help you to find the right research talent to provide you with specialized knowledge. So I kind of want to talk about the benefits of working through collaboration once you have launched your venture. Of course, as Sean probably would agree, in his 40s, one is the team. To getting to know the potential talent before hiring and building your team is important. So working through collaboration could help you with that, and also to explore the feasibility to further develop your tech, and also really create some temporary projects so that you can de-risk your investment, which helps with another T, treasury, before you go make the decision to go full on to certain larger investment. And I will also later show you as one of our recent programming, we can also help you with your market traction. So probably helping you with the 4 Ts that ESUBC has developed. And I also want to mention that as some of you are considering transitioning into the commercialization stage or just finding collaborations with potential industry partners, MyTechs are here to support in all stages. So whether you are just first transitioning out of your lab or the company you are considering working with is exploring furthering or improving their existing products or processes, we will be able to help, and we support the innovation at all stages. And also, like I mentioned earlier, we are sector agnostic, net agnostic, and discipline agnostic. So really from STEM to social sciences to business, as long as there is innovation. I didn't even only say research. So research and research supporting activities, we will be able to support. And this is a quick illustration on how things are working together, whether it's startups working with academic institution, and maybe we can even also have multiple companies working together to build out the supply chain through a collaboration through academia. And when it comes to the funding, so we are in a really fortunate position. During the pandemic, we were part of the response from the federal government to provide more funding into research institutions to students. And despite of the pandemic, we were able to quickly deploy those funding to provide support when the research disruption was happening. So in the recent budget, the 5-year recovery budget, we were able to secure additional funding from the federal government, namely 708 million. So we are in a really fortunate position with regard to the resources. And our funding model is still really flexible and responsive. We can build projects from either 4 months long to multi-year long, depending on the needs. And the contribution typically is 50-50 split from the partner organization, which is the industry partner or not-for-profit partner, and MyTechs would cover the other 50%. But I'll quickly mention that currently, because of our fortunate position of financing or resourcing from the federal government, we are providing a 3-to-1 matching for small to medium-sized enterprises in Canada. Right now, the deadline for that obviously is March 31st to accommodate the fiscal year end, which is end of March. But we are definitely assessing the situations, exploring the possibility to bring back the matching to allow the collaboration to be more de-risked while the economy is off to the recovery. And I'd like to also mention, given that I'm talking to a group of health researchers, very different from CIHR that you are very familiar to, the MyTechs funding is not a competition. The applications don't really have a deadline. It is first come, first serve. What we do is we conduct a peer review for the funding proposal to assess the validity of the project. And once that's passed, we'll be able to award the funding. So as long as it's a really good project, and you have heard me right that we do have abundance of funding, we'd love to support your project. And I also did mention when it comes to innovation journey and also the traction piece, for the venture is beyond research. So research is fundamental, but also all the supporting activities beyond the research is something that's really enables a startup or a company or really an invention to come to fruition. So last year we started a business strategy internship program to complement Accelerate program, which I just showed you. It is the same funding model, but the BSI program, Business Strategy Internship, is geared towards development and business activities, the surrounding innovation agenda. It is still going to be a collaboration between a company or not-for-profit and a university, and the students, the trainees are still going to get involved. The funding level are the same, and also they will also see the enhanced leveraging that we're providing to small and medium enterprises. This is just a tool to really encompass more activities in the innovation stage. I want to do a quick recap. And if you think about innovation as a triangle or commercialization as a triangle, the industry is the end user, or the industry is the need, where the needs come from. And faculty members and trainees provide the expertise to support addressing the challenges. And in the meantime, it's a win-win-win situation for everybody. Because of the rigorous research review we conduct, we want to make sure this collaboration benefits faculty members to further their research agenda, for students to learn new skills and get exposed to business opportunities, for industry, for the company to also benefit from the state-of-the-art knowledge and expertise. So I would be remiss to not mention that in our mind, industry means for-profit, startup to multinational, not-for-profits in Canada, municipalities or regional governments. And as of this year, we also expanded to recognize hospitals also as eligible industry partners. So some of you might have been benefiting from the VCHRI competition, and we love to see more come in the coming years. With that, I'd like to thank our founding partners, the federal government and all the provinces and territories. And thank you again for your attention. I have all my contact info listed here, and feel free to reach out to me. My team are always ready to speak with you. Thank you.
Thanks so much, Sherry. That was fantastic. Super informative. I think both for people who are familiar with MyTax, because there were lots of updates there, and also a great introduction to MyTax for those who aren't. I know I certainly have some follow-up questions, but we're going to leave, and I can see at least one in the chat, but we'll leave them to the end. So thank you again. And next up, we will have Arushi Reyna from Praxis Spinal Cord Institute talking about the work that she is doing and that the organization is doing there. Arushi, over to you.
Great. Thank you so much to the VCHRI team for having me. It's a pleasure to be here. Can everyone see my screen? Perfect. Thanks, David, for the thumbs up. It's affirming. So when I was reflecting on the title of my talk and the title that David and the team have put forward, I was thinking, what's the gap here? Because we love talking about gaps in the startup space. And I think what we need to do in the beginning, I have about 9.5 minutes to chat, is I want all 39 of us to think of one truly terrible startup idea you have in the health sciences space, or any space, but health sciences. And in 10 minutes, I want you to decide what that idea is and hold on to that idea. And I'm calling it terrible, so no one can have an excuse that they didn't come up with an idea. And a lot about what I want to talk about is, I had 5 hacks, I had 3 hacks. The idea is just to have some ideas and see what comes of it. So hold that idea in the next 10 minutes, and I'll talk a little bit about what we do at Praxis and how those two disparate things link up. So I might be coughing for a bit of this, so I apologize in advance because I'm just recovering. I want to talk a little bit about what we do at Praxis, formerly the Atkinson Institute. I want to talk about some of the programs that are available for really anyone in the world to apply to, some examples of case studies or startups we've worked with so far, and some lessons learned, and we'll loop back then to the truly terrible health tech idea you have. So what we do at Praxis, we work towards a vision of a world without paralysis after spinal cord injury. And I joined Praxis in 2019. I knew less than nothing about spinal cord injury, and I said, how how do we even think about this? And what we do in the commercialization team, the team that I lead, small but mighty, is we try to bring transformative technologies to improve the quality of life for people with spinal cord injury. So one of the ways, and when I was trying to understand how to work in this space, was how to ground ourselves. What does that mean? And so one of my colleagues who has a pretty severe injury, he says even the smallest advancement in medical technologies has life-changing impacts. So we take that as a grounding theme of even the smallest advancement in technology has life-changing impacts. Now, one of the biggest questions we get from the startup community, from researchers is, well, I don't work in neuroparalysis. I don't think your programs work for us. And so we need to really redefine what we mean by transformative technologies in the space. Really, spinal cord injury is one of the most severe injuries you can have and still survive from. So what that means is that almost every part of the body, particularly the nervous system, is involved. And so we're really, really excited by problems that address these larger problems. So solutions that address these broader problems. So for example, pressure injuries. We want to talk a little bit about that today, bladder and bowel, even psychosocial issues, neuropathic pain. And sometimes, if you're new to the field as I was, I didn't see how they connected with spinal cord injury, but really they're the core to having a life-changing impact for small incremental change in these areas. So I want to jump into some of these examples of problems and how we've supported technologies in this space to hopefully have that kind of impact. So pressure injuries. Before joining Praxis, this was not the topic I was focusing on. I was focusing on traumatic brain injury. But when I learned about pressure injuries, they're not a fun thing to talk about, but how pervasive they are in our health system, in the hospital system, even today with COVID, for people who are being ventilated or have to stay in hospital, in causing not only severe discomfort, but actually causing death, and causing death in spinal cord injury. It really became top of mind of how we address that. Another issue that really is mind-boggling given where we are is they're really not good solutions to neuropathic pain. We have a lot of solutions to pain, and some of them, such as opioids, are really not the answer. But for neuropathic pain, there's really not enough solutions. And people with spinal cord injury, really most of people with spinal cord injury, are experiencing a level 3 to 10 of neuropathic pain, pain that traditional medication is not addressing. And third problem that we're very focused on is bladder and bowel health, and particularly UTIs. UTIs impact a broad variety of the population, not just people with spinal cord injury, but again, not only does it cause chronic lifelong conditions that it really limit your quality of life, but also cause mortality, cause death in people with spinal cord injury. So why am I focusing on some of these problems? Because when we did a scan of the technology, sometimes effective solutions for neuropathic pain really don't exist. If there are, please contact me right away, because we're really looking at technologies in that space. In the space of pressure injuries, some cases, the standard of care, we're dealing with 100-year-old ways of dealing with this, and it's okay, but it's really not good enough for where we are in the world today. And in other cases, we have chronic conditions that have really costly solutions that aren't really truly accessible and do not meet the variety of needs in that space. The other thing when we were going about trying to support ventures in the space was, well, how big are these markets? And these are conservative estimates, as Entrepreneur Space told me, but they're estimates. And these markets are billion-dollar markets. So yes, people with spinal cord injury are a small subset of the population of people with different types of conditions, but the problems we're going after are really global and universal. So what we try to do is we foster or support technologies in these disruptive spaces. So we've picked up a technology I want to talk to you about a bit later that really looks at KCC2 inhibition and how to actually address not only neuropathic pain, but autonomous function, ability to walk, as well as other neurodegenerative conditions, including conditions such as epilepsy, in actually having a platform effect on a number of different impacts, not just neuropathic pain. Another technology that really we helped support in pressure injuries was, instead of using mats and turning people over, how about we using stimulation to actually prevent pressure injuries by increasing blood flow. And another technology looked at was actually, I like to call it an artificial bladder in the body, but that's a simplification. But really, what if you had control, if you had a condition where you actually didn't have control over when you went to the bathroom, how to protect yourself from UTIs? What if you could take control back into that and be able to take control of when you void, but also protect yourself from UTIs? And that's the catheter technology that we help support. So I told you all of these kind of technologies that we go after to explain what we're trying to do at Praxis, which is really cut down. I know Sean referred to it and others. There's a gap, there's a valley of death. There's a place where people come up with really good ideas or really terrible ones, and then there's nothing. Where do they take that idea next, right? And what we want to do is test that idea in the most low-cost environment as we can, and bring it forward to people who need it to actually test that idea with you and increase the chances of it reaching people with spinal cord injury and other people in the world. And the way we've done that is through 3 or 4 key programs. So I have TRL levels on the top, but really these 3 programs that we work on actually address different levels of progression. So when we look at the SCI Accelerate program, typically you've raised some money, you have a prototype, i.e. you've got some type of object, or maybe an object, but a therapeutic that you've tested with some kind of population, you've raised some money, and you're really looking at how can I get 3 of these widgets or 300 of these widgets to become 3,000? How do I hyperscale it? How do I actually get people to get this product paid for? And so the Accelerate program really brings end-to-end services in this space. And the Incubate program is really for a little bit earlier where you have less data, but you know what, you've got something like an early prototype, not really ready for market, and you need to further test it and refine it, but you've done some of the initial work so that you can actually be able to test it in a more robust way. And last but not least, and this is where the terrible idea comes in, is we have the ideation program that we're doing in collaboration with the University of Toronto. And what we're looking for in that, and actually submission is tomorrow, we're looking for really back of the envelope kind of ideas. It's really not about having the most fully fleshed out idea. Just pitch an idea to support people with spinal cord injury in a broader population and see what comes back. The ideation competition, what's really unique about all of our programs at Praxis is we have a person-first approach. So we have people with spinal cord injury embedded in each stage of innovation. And we've moved away. Surveys are great. I know I'm talking to a lot of researchers. Surveys are great. But we moved away from that. What if you talk to someone with spinal cord injury every day? What if they gave you feedback every day on what you're forgetting, what you're missing, how you should change the user interface of what you're doing? How would that hyper boost, hyper scale what you're doing, speed up what you're doing, but also make it really challenging to produce something that's people really want? And so with a terrible idea, I really encourage you, if you have anything in this space, apply to our program. And if you're not, it's not fitting our place, please test it out. This is 2022, and the subject of this talk is how to bring that idea into the space of having it tested. And it doesn't matter if it's a terrible idea. You only know that when you've tested it. I talked a little bit about this, but really people with spinal cord injury are at the core of what we do. And so I think that's the really unique thing that our programs provide, in addition to the great funding, regulatory reimbursement expertise, is prior to joining Praxis, I worked in a startup. And in the medical sciences space, there's a lot of great regulation. I respect it. But talking to someone with the lived experience, with the challenge you're trying to address, is really hard, because you can't just go around doing that. It's not like testing a dating app and going around and asking people, because it's a universal thing. This is a health condition, and you have to create a space that's respectful, but also gives you honest feedback, not what you want to hear. And what if you don't have to talk to them every 6 months? You can actually talk to them every day. And what if they're not just being surveyed, but they're reacting to what you heard, what you thought you heard, and you put that into the product? And what if they have a reaction to that? And all those kind of ways in which we've got people with spinal cord injury not being surveyed, but actually mentoring the companies, has really shifted the outcomes for now over 20 companies, has shifted the way we think about innovation, but has also really broadened the scope of the types of problems we go after. So this is a small subset. We only launched in 2020, but we've been following 10 startups that have graduated within 6 to 12 months. And we've provided $500,000 in grant funding. But even in that time, within 12 months, they've raised over $12 million. We directly funded 4 registrations, and we have had directly funded 5 patents. They've filed others, but we actually directly funded 5 patents. So this, again, we had this idea, and everyone said, spinal cord injury, really? You're going to start an accelerator in this space? Is this really what's needed? Well, I followed my own advice, and we weren't sure it's a great idea, and we tested it, and now we've got some test data, and now we get the chance to refine. So what to expect? So the ideation program, I'm actually going to put it in the chat because I really encourage anyone with an idea to post their submission. It's a very short submission. It's a back of the envelope thing, but often we get a question about what our other programs look like. And so our programs are between 4 to 6 months. They're very intensive. You're talking to someone with a spinal cord injury who's your mentor. You have basically a business mentor, and you have a consumer or a person with lived experience mentoring you. You get access to people with manufacturing experience, reimbursement, i.e. who will pay for your product, regulatory experience, and we really customize the approach. So we work with 5 companies at a time, and we try to throw the works of what you need to build a successful company from what you do. So that's really what we're trying to do.
Arushi, we're just running out of time.
Okay, sure.
another minute or so.
Yeah, sure. I needed to time myself. So we've got some case studies. Happy to talk offline. I'll just leave it to the 5 lessons that we've learned from doing this work. So there's no such thing as talking enough to the people who will be using your device. You're building a company, not just a technology. If a lack of funding is your problem, maybe there's another problem behind that. 100 bad ideas or terrible ideas are just better than 0 good ones. And it's never too late to change your mind, change your idea. So apologies for going over a bit there, Sean, but hopefully we left you with a few ideas, and I'll post the Ideation Clinic link below.
Thank you so much, Arushi. That was fantastic, and I loved your final slide there because so much resonated around your lessons learned, and also I think the helping people to understand the extent of opportunities to make impacts is also so important. And I also have to apologize because in my excitement to hear your presentation, I didn't introduce you. And so if you'll just indulge me for just a second, Arushi did a good job of introducing herself. And again, apologies that in my excitement, I glossed over that. But if you'll just indulge me, everyone, I will just introduce Arushi briefly. So Arushi mentioned that she's Director of Commercialization at Praxis, working to bring innovations to market. Arushi helped to design and launch the SCI Innovate and Accelerate programs that you just heard about, which are the only spinal cord injury focused accelerators in the world. She has an experience in the healthcare ecosystem at the local and provincial levels and has led the facilitation of clinical and executive teams to develop new innovative care models and solutions to improve quality of care. And prior to joining Praxis, Arushi worked at a pre-seed neuroscience startup focused on cognitive interventions for people living with traumatic brain injury, as you heard. Arushi holds an MBA from the Richard Ivey School of Business and draws from her work across several sectors, including retail, real estate, manufacturing, healthcare, and the public and nonprofit sector. She was a prior BC 30 Under 30 awardee and holds an honors in economics from Vassar College in the United States. So thank you once again, Arushi. That was fantastic. Really enjoyed your presentation, and apologies again for glossing over your introduction. Next on our panel, we have Eric Atkinson. As an industrial technology advisor with NRC's Industrial Research Assistance Program, Eric works directly with SMEs, small and medium-sized enterprises, developing innovative life sciences technologies for commercialization by providing technical and business advice, creating linkages to resources and expertise, and providing funding for projects that help move the technology closer to commercialization. Eric holds a PhD in biochemistry from the University of Alberta and an MSc in immunology from the University of Manitoba. Prior to joining Nrc Irap, Eric was the co-founder and chief business officer of Reach Bio LLC, a Seattle-based contract laboratory research services company. And prior to that, Eric was the head of corporate development at Stem Cell Technologies in Vancouver. Eric, over to you.
Thanks, Sean. I'll just share my screen, and I can't see any of you. So if my screen doesn't share, somebody pipe up.
There we go, got it.
Great. So yeah, thanks to the organizers and David for inviting me to speak at the event and to tell you a little bit about Nrc Irap. So Irap is the one of the key programs that the federal government has to support small and medium-sized companies that are developing and commercializing innovative technologies. We are part of the National Research Council, so our funding comes from NRC through the federal budget through NRC, and then there's a portion for IRAP. We're currently at about 320 million, I think, for this year for the money that goes directly into support of SMEs. Our mandate is to stimulate the wealth creation for Canada through innovation, and we do this by helping to accelerate the growth of innovation-based SMEs by providing a variety of types of advisory services, connections to appropriate business and technical experts, and sometimes we help with financial assistance through funding of focus projects that help move a technology closer to commercialization. So I understand that most people do think about IRAP as being primarily a funding program, but in fact, it really is largely an advisory program. As an example, last year, IRAP served over 9,000 clients across the country, but only about 3,000 of these received funding, and the rest received some sort of an advisory service. So who is it who's giving all of this advice to the SMEs? It's the frontline people at IRAP that deal directly with the clients that are we're the industrial technology advisors, our ITA, so people like me. So IRAP ITAs tend to be mid to late career professionals from a wide range of sectors, and generally they've got extensive experience in business management, technology, development of technology and commercialization, entrepreneurial experience, some kind of mixture of that. So when we're giving advice to our client firms, that kind of background is generally sort of from the position of, or the context of, yeah, we've been there, we've done that, we understand, what your needs are, and we work very closely with the clients in that respect. So across country at the moment, there's about 265 ITAs that are in all different sectors. Here in the Pacific region for IRAP, Pacific covers BC and the Yukon. There's about 50 ITAs in total. Roughly 10 of us would have backgrounds that are relevant in some way to the overall biomedical sector. But 5 of us have backgrounds in what I would call the wet and sticky sciences, like biochemistry, immunology, pharmacology, microbiology, that type of thing. The other half have backgrounds in things like medical devices, engineering of medical devices, digital health, ICT and engineering types of backgrounds that impinge upon the health sector. And how we, the ITAs work with our client firms is that a client firm will have a lead ITA, and that lead ITA hopefully has a pretty relevant background for that particular firm. And then the lead ITA will build a small team of other ITAs to help with the client, and those other ITAs should have synergistic backgrounds so that we sort of address all of the kind of needs that the company might have. So we work with our client firms as teams, but the main point of contact for the firm is the lead ITA. So, yeah, as mentioned, we really do try to match the ITA team's experience and knowledge with what the client firm is doing, both from a technology standpoint and from a commercialization or a business model standpoint. So, and from that type of foundation and background understanding, the ITA team then tries to build a really trusting relationship with the client firms. We end up working very, very closely with the clients so that we can build on our understanding and develop a really good understanding of what the firm's growth objectives are and what their gaps and needs are. And those change over time too. So that means that we can tailor our advice and connections and potentially funding and other resources so that we can make the biggest impact on the growth acceleration of that company, do things that really try to help move the needle for that company. So every client is going to have a unique situation. And the one thing about IRAP is that we can tailor things very specifically to the client so that the things that we do are as unique as the clients for that particular client. So let's talk about IRAP funding and how it works and what we can and we can't support. So funding is through projects, specific defined projects, and those projects are going to have a defined objective or a set of objectives that are achieved by defined activities. And these are written down in a contribution agreement that becomes a legal agreement between NRC and the client that this is what you're going to do and this is what we're going to support you to do. So the objectives and activities are going to be things that should be moving the firm's technology along the development path towards commercialization. But one of the fundamental things that you should understand is that the type of funding that IRAP can provide, it's not a grant. It's a contribution towards some of the costs of a project. And there's some pretty fundamental differences between grants and contributions. For one thing, there's differences in how you have to account for it and the fact that contributions can actually be audited, subject to audit, where grants generally aren't. But the most relevant thing to understand, I think, from early company standpoint, is that the IRAP funding is not provided as a lump sum upfront, like a grant is. It's actually provided as a reimbursement. So the client firm needs to have incurred the eligible expenses first, and then you claim for the reimbursement, usually monthly, and also then provide a status report that sort of explains what it is that you did during that claim period that we are going to reimburse you for. So, and those need to be matching up with what the objectives and activities within the legal agreement, the contribution agreement says. So a couple of things derived from that. Since the IRAP reimbursement level for eligible expenses is not 100%, and I'll get to that later, and since we only cover certain types of expenses, which I'll also explain later, the client has to be able to demonstrate to us that they have the financial wherewithal to fund their share of the project costs and to be able to bridge the gap between when they paid for the expenses and when IRAP reimburses them for it. That can be 2-3 months of a gap. So that means that IRAP projects aren't necessarily a super good fit for a brand new day one startup with absolutely no capital and no way to fund the ongoing operations. They're really better suited for companies that have at least a modest level of initial investment, or maybe revenue stream, some other way of financing their operations. There's always exceptions, but I mentioned at the beginning, our mission is to accelerate the growth of SMEs. So we're not here to help a firm get started from absolute zero, and we're not here to throw a lifeline to a firm that might be circling the drain or sinking. We're here to push growth. Okay, so just a few words about the types of things that IRAP can support. Basically, we support the technical team, the technical work that's involved in research and development projects. We can provide partial salary support, usually up to 80%, for internal T4 technical employees that are working directly on the IRAP project, just for the number of hours that they specifically work on that project. We can also support some technical contractor costs. So you might use contractors in various ways. We might even have, you might not be in a position to be hiring a employee full time, but you want to in the future, and you start off hiring a person as a contract employee. They're technically a self-employed individual. They can get supported through IRAP projects, but at the contractor level of 50% rather than the T4 level at 80%. Things that we don't support are listed here. Things like employee benefits. We don't support the equipment and consumable costs of the project. No patenting legal costs. We don't get involved with clinical trials normally, don't support manufacturing, and usually not travel. So again, the focus that IRAP takes is very, very much tailored to the company itself. That means that we have to have a conversation with you. It's hard to kind of put down a list of things and say, yeah, apply for this, apply for that. It all starts with the conversation and developing that trusting relationship. But to get connected with IRAP and possibly to get your lead ITA assigned, you need to meet these, fairly, very basic eligibility requirements. You need to be incorporated in Canada, SME meaning 500 or fewer employees, and you should have a bona fide growth plan that you're going to grow through commercialization of innovation. The types of things you'd be doing is R&D projects that have technical risk associated with them. So the entry these days into IRAP from somebody outside who is not yet engaged with IRAP is to call this 1-800 or this 1-877 toll-free number that's on the screen. That's a national call center that will put you in touch with what's called a client engagement advisor or a CEA. CEAs are very, very similar to ITAs, but they'll work with companies who want to engage with IRAP to understand them a little bit, understand where they're at, determine is IRAP right for them at this stage, or maybe there's other government programs or other kinds of programs that are better suited for that particular company at that particular time. If they do ultimately determine that IRAP is a good fit, then they will put you in touch with an ITA, hopefully with a relatively good experience and background for you, and then we'll start the conversation. So I'll leave it there and happy to answer any questions that might come up in the panel session.
Great, fantastic, Eric. Thanks very much. We're running just a couple of minutes behind, but that's fine because we'll be able to make it up in the Q&A session. I'm pleased to introduce Mr. Pat Brady as our final panel speaker today. As director of the I² Fund, Pat is focused on advancing genomic and other life science tools and technologies from the research stage through to commercialization. Pat is with Genome Bc, of course, but for the last 30 years, Pat's been involved with funding and growing innovative companies in the life sciences field. Prior to joining Genome Bc in its current role, Pat worked at Inex Pharmaceuticals in its formative years, which goes back to maybe number 2 or number 3 of Peter Cullis's startup companies, and then spent nearly 18 years as a venture capitalist with GrowthWorks Capital. Pat has accumulated broad insight from many successful management practices and strategic issues encountered along the commercialization pathway. Pat, over to you to learn more about how you help with resources.
Okay, thank you very much, Sean, and thank you for David Granville for inviting me to participate in this great event. And I'll dig right into the many programs at Genome Bc, except I'm having a little issue trying to advance my slide. Okay, it seems to have frozen. I'm having a trouble with the slide deck here. I'm just going to.
Hey, Pat, did you want to try just clicking with your mouse and see if that advances the slide?
Yeah. Oh, there we go. Thank you.
You're welcome.
Thanks, Kara. I'm a Luddite here. So anyways, Genome Bc. Genome Bc has a cumulative portfolio of over $1.1 billion in more than 425 research projects in science and technology platforms. And we invest in research, entrepreneurship, and commercialization in the key sectors of economic importance to BC and Canada. And health is probably by far our largest sector. So Genome Bc is part of the genomics enterprise in Canada. There's 6 other genome centers across Canada, as well as the all-encompassing Genome Canada organization. And Genome Canada just recently had $137 million awarded to it by the federal government, obviously partially in answer to the ongoing pandemic. They've also created a number of programs that are quite active. Cancogen and All for One are active and giving support. And another one that I'll be talking about a little later called GAP. So Genome BC has been very active with many academic research centers across the province, as shown here. We also have had many organizations from around the world participate in our research funding. And these are just a partial list of those organizations worldwide. And we have helped support at least 100 companies in BC. And I'd have to say, for Eric's benefit, almost all of these companies will probably have an IRAP or two grant as well. It's very, very popular program, the IRAP program. I think it's very strong. So today I'm going to be talking about basically 7 different programs at Genome BC that are helping to support and are active in supporting the innovation sector in the province. And as you can see from this, this is the classic discovery to commercialization curve. And this shows where the various 7 programs at Genome BC are most active in. And the work, quite a bit of it is in the pre-seed and seed stage or the early R&D stage. And we do have a couple of programs that are certainly going beyond that stage into more of the commercialization side of things. And the I² Fund and the EPP program that are shown in green arrows are programs that actually are supporting technologies and companies that are active just outside the omics tech field as well as inside omics. So a broader mandate for the I² Fund and the EPP program. So I'll start with the I² Fund, and this is the fund that I'm overseeing at Genome BC. And this is a list of the various technologies and science that we are supporting with the program. I would have to say most of our investments, and fund's been around for about 5.5 years now, most of them have been in the diagnostics space, digital health, medical devices, and lab equipment. So that seems to be where our focus has been lately. So the program essentially is a hybrid venture debt type of funding. The debt is not repayable until years 5 and 6. And it's very low single-digit debt cost. And then there's also a royalty, also low single-digit, that is applied, and it's capped once it hits 2 times the investment value. Funding allocations are roughly $500,000 to $1.5 million per company, and we are putting the money into companies. The matching funds are at least 1-to-1, so we'd like to see funds in the company that are at least the amount that we're putting in. And there's also got to be a clear pathway to commercialization for the company. They don't necessarily have to be in a commercial stage. They don't have to have existing sales, but that must be demonstrated to be feasible within a 3 to 4 year time frame. And here's a listing of some of the strong values that we'd like to see in the company, characteristics. We do want to see a complete and viable business plan. While we prefer to see qualified and experienced management team, we are quite flexible in that regards. And we certainly have some young teams that are doing very well, but not necessarily had a full depth of experience that perhaps a later stage company would have. And we definitely want to see that the technology is backed by strong IP protection, and there's a strong market potential. And there's also financial capacity to execute with various funding programs. Here is the current list of our portfolio. There's 12 companies here. I'm sure you'd recognize many of these. And a number of these are also graduates of the E at UBC program. So thank you, Sean. And we're very proud of this portfolio. So our next program that I'll talk about is one that is actually overseen by Genome Canada. It's run across the country with all the genome centers. And it's called the GAP program, or Genomic Applications Partnership Program. And this program essentially involves having a sector partner, either from industry or certain organizations, government-related organizations that are partnered up with academic researchers across Canada, and here in BC's case, obviously, the various research groups. Right now, GAP is actively taking intakes. They have a program intake 23. This is number 23, and the deadline is March 7th, 2022. The themes or the technologies invested in must have a omics relation to it. However, it's broad sector and broad coverage of the applications for the omics. And the technology should also be at a point where feasibility has been somewhat established, and that the funding that could last from 6 months to 3 years will help take this technology to a commercial stage. Typically, the investments can run from $300,000 all the way up to $6 million. Genome Canada will provide a third of that investment, up to $2 million, so a pretty big chunk. Well, Genome Bc, if the company or if the partnership is based here in BC, we will contribute up to a maximum of 1/6 of the total, and then the industry partner is expected to more or less put up the balance of the money. And here are some examples of companies that have acted as partners or sector partners, or receptors as they call them. And as you can see, it's not only just private sector companies, but also several government organizations are involved as receptors. Next, I'm going to talk about our GeneSolve program, which is similar to GAP in that we have an industry partner or an academic partner involved, and they are partnering with the academic researcher. The funding will go to the academic researcher. We typically have budgets of $75,000 to $500,000, of which Genome Bc will fund up to $250,000. It's a rolling intake, meaning that we'll take applications ongoing throughout the year. And basically, the projects can be 6 to 24 months. Those main issues. And here are some of the partners we've had with GeneSolve to date. These are the partners that partner up with the academic researchers. And now a new program that we just introduced in 2021 in the midsummer was the Pilot Innovation Fund. And this is where the funding will go to scientific research, usually in universities, but can be certainly based in an industry company. The research is usually at the TRL 3 level, where proof of concept has been established. And now they want to take it to the next step up, at least up to prototype and then beyond. We've funded 4 to 6 projects to date, about $250,000 per project. And roughly the project term is about 12 months, and no co-funding was required. This program will most likely be repeated. I'm not sure exactly of the timing, but we're very happy with it. And I think we'll be definitely continuing this program in the future. And several other Genome Bc programs that are active and funding actively. One is called the Sector Innovation Program, or SIP. And this program is contributing roughly $75,000 to $250,000 per project from Genome Bc. No co-funding is required. Project terms are 12 to 24 months. And we have a SIP number 8 that's going to be focused on data, and the timing is to be determined, and certainly contact us if you'd like more information. Last, we also have the Societal Issues Competition, and this is a funding that goes towards researchers looking at certain societal economic issues from genomics, introduction into society. And the funding is usually up into the $250,000 per project. We are currently focused on having some demonstrable experience in Indigenous methodologies and or working with Indigenous partners. And no co-funding is required. Last, but certainly not least, I want to just mention briefly the Economic or the Entrepreneurship Partnership Program, EPP. And we are currently supporting 6 accelerators, including the Praxis group that presented today with Arushi, and also E at UBC, where Sean is leading the charge. So this is just an indirect funding for our program to help these great accelerators across the province assist in the growth and commercialization of our young companies. And that is it. Certainly you can feel free to contact me if you'd like more details on any of these programs. Thank you very much.
Fantastic, Pat. Thank you so much. And really appreciated you reviewing the multitude of programs and resources that are available through Genome Bc. And thanks to all of the panel members for giving us some insights into their organizations and the role that their organizations play in supporting innovation translation, in the local community. We have about, just looking at the time, we've got about 20 minutes. Apologies, about 15 minutes for Q&A. We've got lots of activity in the chat. I've got some questions I was going to use to kick us off, but we've had some interesting questions in the chat, so maybe I'll kick off with those. Mali Maibod has a question for Sherry Zhao at MyTax, as well as a question for Eric at Irap. Mali, did you want to pose your questions, please? I'm not sure if you can unmute. Yep, okay.
No, I am struggling. Hi, first of all, thank you so much it was like very great session. I have 2 questions. The first one is that to be qualified for IRAP, does the first market that the intern generate revenue, should it be Canadian market or no go-to-market strategy that mainly target US market qualify as well?
Yeah, so money's money, right? We're trying to have get companies to grow, get revenues, stand on their own 2 feet. I think one of the things that I notice sometimes about companies that are starting off when people haven't, or the founders haven't had industry experience before, is that they do think a little bit too small. They think about what's in their back door or their backyard, and they focus on Canadian, sometimes even like BC. It's like, no, the world is your market. Money can come from everywhere, and in terms of benefits to Canada, money from outside of the country is actually better than money from inside. So it doesn't matter where it comes from.
Perfect, thank you. And the other question is about qualifying colleges or universities for MyTax. Like, if you can just comment on that, should we check with you or no, there's a list that we can check?
You don't really need to check with me. So for the MyTax eligible institutions are the same as the Tri-Council eligible institutions. So basically UBC or most of the institutions in BC are eligible. If they are not yet a MyTax member, we can always just quickly onboard them as a MyTax member. But I don't think there are any that's left out in BC.
Great, thank you so much. David had a question for Sherry as well. Could you clarify who is eligible as a not-for-profit for the matching funding, and which types of funding are 1 to 3 versus 1 to 2 partner to MyTax matching?
So for not-for-profit, they need to be incorporated in Canada, and they need to receive their funding no more than 50% from the federal government. They can, and David and others, please do feel free to reach out to my team. We can always do a quick check about the eligibility. But if you remember from the presentation, there's a triangle of the collaboration that I presented. For the not-for-profit to be providing funding, we also want them to participate in this partnership so that the PIs also get the collaboration, the trainees also get the value of getting exposed to a different environment from what they are already in from their study. So we wanted to make sure that as well. In terms of the enhanced leveraging, that is for small to medium enterprises, including business and not-for-profits. And as Canada being a nation of SMEs, I think most of the ventures or industry partners we'll be interacting with will qualify that 1, 2, 3 matching, which means MyTax will cover to up to 75% of the cost, minus a few really anchor companies in the region. But the rest would also still be our regular 1-to-1 matching. So if you are working with stem cell, in that case, it will still be our 1-to-1 matching. And or if you're working with a foreign company while demonstrating the benefits to Canada, that's still going to be a 1-to-1 matching.
Apologies, I was on mute talking to myself. Thanks very much, Sherry. Someone had to do it. Happens every Zoom meeting, someone forgets to unmute. That was great. I'm gonna not elevate, but I'm gonna take the conversation up a notch in, I guess, abstraction. So we often get this question from potential clients or applicants to entrepreneurship at UBC. When's the right time to engage with your organization? And I'm going to open that up to everybody on the panel. I would love to hear from everybody on the panel. We often get a lot of confusion about when is the right time to engage with entrepreneurship at UBC, and I'm happy to talk about that. But I wanted to pose it to the members of the panel. When's the right time to engage with you or colleagues at your organization to explore an opportunity?
I can start, and I see Pat's unmuted as well. Really, never. It's never too soon. So it just, what bucket do you fall under? So if you're really early and you don't know, ideation is the perfect thing. There's a whole team supporting that. If you're a bit later stage, just contact us. We'll tell you it's not the right time. Let us decide for you instead of feeling stuck for you're sitting on an idea because you think you're not ready.
Great answer. Thanks very much. Others want to chip in?
Well, we have a number of programs, and some of them are continuous intake, and some of them are more competitive and held, intakes once a year. So it's really all over the map. The I-Squared Fund for companies, that generally will be probably about a 3 to 4 time a year approval process, given the fact we need board approval. So it's quite varied depending on the program.
Yeah. I'll go next.
Go ahead, Eric.
So for IRAP, one of the reasons why there's that 1-800 number that gets people connected to a client engagement advisor is so that firms can start talking to us at any stage, really. And there's definitely a good time to be engaged with IRAP to benefit from the services and the funding that IRAP has. But at any time, it's good to engage with the client engagement advisors, because IRAP isn't the only game in town. It's for growth. It could be very, very early stage growth, but still there has to be something going on with the company for us to be interested in it. But those client engagement advisors, they used to be the concierge people before ISED took that over. They are really knowledgeable about a lot of different programs there. So they work for IRAP, but they're knowledgeable about not just IRAP, but a lot of other governmental programs. So it's really worthwhile to have a conversation with them. And if it's the right time that they think is the right time, they'll connect you with IRAP. Otherwise, they're really good at connecting you with other resources.
Great. Thanks, Eric. Any other thoughts from the panel? Sherry, did you have anything you wanted to add?
Yeah, likewise, I think I'd like to actually encourage people to reach out to us early. as soon as possible. Really, when you have an idea, feel free just to reach out. Like I mentioned, that we do support all stages within the company, within the collaboration, and also the activities around research and research supporting activities. So just always have a conversation with my team. We can always try to figure out the way. I know this is being recorded, but currently we do have more funding than we can spend. So I guess that's a good news. So please do reach out.
Great. That's good to know and to have recorded. David has popped a question into the chat for Pat. How much does the company's product or technology have to relate to genomics or omics more generally? So can funds from GAP or other genome funding be applied as matching for or dependent upon Series A financing?
Well, if the first question is about the I² fund, the fact is that probably most of our investments have been in technologies that are not directly omics related. So we're quite broad with the mandate of the I² fund, especially with human health projects. The rest of the programming that I described is really focused more on omics technology, including GAP. So there definitely has to be an omics involvement there. And obviously the EPP program, the accelerators are also quite broad, but they're all active in the life science sector. I hope that helps.
Right. I think, yeah, there was a second part to the question, which is, can the funds from GAP or another genome funding program be applied as matching or be dependent upon Series A financing? So can, I guess, David, maybe jump in if it's unclear, but can there be risk capital, contingent risk capital be applied as matching funding for the program? Like, will you award it contingent on the company raising funding?
Right. I would say no. That would be quite unusual. The funding, the matching funding generally has to be secured before we would move forward with our funding.
Right. Right. Good question. Great. Are there other questions? That's okay, Molly. I'm interested in, well, I was going to ask a question about support for startups, right out of the gate, but Eric, you did a great job of articulating where IRAP can be appropriately applied in terms of resources from IRAP, can be financial resources can be appropriately applied, and what's required of a company, minimum requirements. Are there, this will be obvious for some of the organizations, are there pre-incorporation resources that are available from your organizations, or are there mechanisms through which a pre-incorporation opportunity, such as we might be working with, this is a little bit self-serving because I'm interested also for entrepreneurship at UBC's clients, and there's also application to Arushi's clients as well. Are there resources available for pre-incorporation venture opportunities where they may not have pulled the trigger on incorporating and then getting some risk capital into the venture yet?
So I'm not going to speak directly to that. I do just want to clarify a couple of things though on that. The comments that I made don't mean that the bar is set particularly high, right? But there is a bar, right? And I'll give you an example of a client that I met with another ITA early on, shortly after I started, that was a researcher at UBC who had what I thought was a really cool technology, and he met with us with his postdoc, and they wanted to form this company and that, and the message was, well, IRAP can only work with companies that are incorporated first, right? And have you done that? And his response was, I'm not going to risk my own money in a biotech startup. And,
that's very telling.
Yeah, exactly. It doesn't cost a lot to incorporate, right? Not a lot at all. I've done it a couple of times myself. It's not going to break the bank. And if you're not willing yourself to put a small amount of risk capital in, or you don't have any friends or family that's willing to put a small amount in, then I'm not willing to risk the Canadian taxpayers' money to invest in that kind of company, right? So the bar isn't super high, but
But
it's
there
not
is one.
zero. Yeah.
Yeah, that's a fair point. That's a great story. Other comments or observations on the whole resourcing pre-incorporated venture opportunities?
So maybe I can add a comment here. With all the MITEX funding, obviously we do need the partner organization to be incorporated, but also knowing a lot of trainees and PIs are considering commercializing the invention that they have from the lab to the market. Sorry, John, I probably used your word again, lab to market. And when you first incorporate, there's quite a bit development or more R&D that's needed for the specific invention that you're working on or you were working on. And the most obvious candidates to work on those are obviously the trainees who have been developing it along the way. So typically, I don't know about IRAP or Genome Bc, whether it is seen as a conflict of interest. It is also seen as a conflict of interest from MITEX perspective, but we have developed a program specifically for the entrepreneurs to be able to receive funding from their own company, partnering with their own PI to further develop the technology. So there is a specific flavor we call Entrepreneurship Accelerate, E-Accelerate, to support those endeavors to make the venture a more successful one. So that's early stage support. Unfortunately, it's not pre-incorporation, but it's just as nice.
Great. Thank you for that. Anything else that you might like to add, Arushi or Pat?
We support pre-incorporated companies in ideation and incubate, and often in incubate or accelerate, if you have a plan to incorporate in the next 2 months that is credible, not fantastical, we look at that amongst a lot of things.
Fantastic.
Just probably to reiterate what I mentioned, for all those Genome BC programs, the only two that really put funding outside of the academic institution is the I-Squared Fund, as well as the Pilot Innovation Fund.
Right.
Those programs are putting money into companies, and all of them have been incorporated to date, and I think we would probably insist on that.
Yeah.
But the other funding, other programs, their funds go to the academic organization.
Thanks for clarifying that. Wonderful. Well, thanks very much. We're running out of time and I need to hand it back over to David to wind up. Just wanted to make a quick observation. I think we've seen some really interesting themes. One that I heard over and over from presenters was trusted relationships, and it takes the establishment of trusted relationships to work together, and also partnerships. So if you are we are all partners and non-competitive. And so if you are struggling, as Arushi mentioned, if you're struggling and you don't know where to start, just start. And you can approach any one of us. And because of the relationships that we have, we will guide you in the direction that you need to go. So I can put you in touch with Pat, or I can put you in touch with Eric, and Arushi can put you in touch with Sherry or myself, and vice versa. We all work with a lot of the same ventures and entrepreneurs in the ecosystem. It's a very tight-knit ecosystem. So just reach out and we'll help you to get going in the right direction. And with that, David, I'll pass it over to you to wind up. Thanks very much.
Great.
Again.
Well, thanks, Sean, so much for hosting and chairing the session. And thanks so much to all the speakers. It was a great session, a lot of good conversation. And just to remind the audience, it's great to see everyone in the audience. And if you have any ideas for future sessions, please email them back in the feedback. And we are hoping for a summer networking. We haven't thrown in the towel yet, hopefully sooner. So thank you all, and hopefully one day we can get back and see each other in person once again. So thanks again to all the speakers and Sean for chairing this session. Take care.